Good morning, everyone. We'll begin today's COVID-19 press briefing with Mayor John Cooper, followed by Dr. Alex Jahangir, Chair of the Metro Public Health Department and Metro Coronavirus Task Force. This morning, we are joined by Dr. James Hildreth, President and CEO of Meharry Medical College, and Dave Pomeroy, President of the Nashville Musicians Association. Director Chief William Swan of the Office of Emergency Management and Nashville Fire Department, and Dr. Michael Caldwell, Director of the Metro Public Health Department, are here with us to help answer your questions. We will now begin with Mayor John Cooper.
Good morning, Nashville. Now, this weekend, our nation celebrated Memorial Day by remembering the sacrifices of those who died while serving in the United States Armed Forces. I am grateful for the courage and sacrifice of Nashville service members. And my thoughts are with all our local military families who honor the memories of their loved ones, especially during this time. Now, yesterday, Nashville began Phase 2 of the roadmap for reopening Nashville. And as I mentioned last week, our public health metrics have indicated that we are ready to get more Davidson County residents safely back to work. As part of Phase 2, restaurants and bars serving food, retail stores, and other commercial businesses can open to 75% of capacity. Live music can return to local restaurants and bars, but with restrictions, to gatherings of no more than 25 people. And hair and nail salons, day camps, amusement venues, and museums can open at 50% capacity. Now, Phase 2 details are carefully outlined in Metro's COVID-19 website at covid19.nashville.gov. Now, remember, your efforts have made it possible to get us this far, and it's your efforts that will largely determine the timing of our progress on to Phase 3 of our roadmap and beyond. By carefully following Metro's public health orders, Nashville business owners, workers, and customers have helped flatten the curve of the coronavirus. Let's keep up the good work so that we don't lose the hard-earned progress we've made as a community. Learning to live and work with the coronavirus will require new, healthy habits. Let's remind ourselves and each other to wash our hands regularly, wear face coverings in public, and maintain a safe distance from one another. By adopting and maintaining these healthy habits, we will be able to successfully advance through our roadmap and ensure a sustained reopening that protects both lives and our local economy. As a reminder, you can view the updated roadmap and leave your feedback at any time by visiting the Metro COVID-19 website. Your comments have helped inform our reopening strategy, and I urge everyone to continue providing your valuable input. As Nashville advances through our roadmap phases, we will continue to closely monitor the coronavirus throughout Davidson County. To examine how the disease is affecting our community, Dr. Alex Jahangir will present the updated COVID-19 heat maps in addition to our latest public health metrics. I want to welcome Dr. James Hildreth, President and CEO of Meharry Medical College, who is with us this morning to provide his familiar, well-informed commentary on COVID-19 and our community's response to the disease. Today, we're also joined by Dave Pomeroy, President of the Nashville Musicians Association, who will announce the development of important public health guidelines for industry professionals and the creation of the Nashville Musicians Association Crisis Assistance Fund. This same fund, now reopened and renamed, was a vital source of emergency support for our local music creators and professionals in the wake of the historic 2010 flood. You can visit nashvillemusicians.org to contribute to the fund as you are able, which is now helping musicians who have lost work and need financial assistance. As a reminder, Metro Public Health and the Metro Nashville Police Department will investigate all suspected violations of public health orders submitted through Hub Nashville at 311 or hub.nashville.gov. Remember, everyone in Nashville has a right to be safe. Responsible businesses across Davidson County have made considerable efforts to protect their staff and customers. So please, show your support for restaurants and other establishments that are clearly prioritizing your health. Now, this past weekend, Metro Public Health Department staff and hands-on Nashville volunteers distributed over 41,000 masks at 4 Metro Parks community centers. The distribution of free masks will continue this weekend at Hartman Park Community Center, Bellevue Regional Community Center, Smith Springs Community Center, and Madison Community Center on Friday, May the 29th, and Saturday, May 30th from 9 a.m. until 1 p.m. As always, please consider contributing to the COVID-19 Response Fund or visit Metro's COVID-19 website to learn how you can obtain direct financial food, mental health, and social service assistance. I'll turn it over to Dr. Alex Jahanger, Chair of the Metro Coronavirus Task Force.
Thank you, Mayor Cooper, and good morning, Nashville. Here's the latest on coronavirus in Davidson County. We now have 4,974 confirmed cases. That is an increase of 153 cases over the past 24 hours. Similar to last week, we had a delay in one lab reporting new numbers to us over the weekend, and thus the number of cases today is slightly higher than typical. However, the rolling 14-day average of new cases remains flat at 86 new cases per day, very similar to the rolling 14-day average 2 weeks ago. 1,347 cases are active, and 3,571 residents, or 72% of all cases, have now recovered from the virus. We did have one additional death overnight here in Nashville, a 90-year-old woman who had underlying medical conditions. This now leads to 56 Nashvillians who have died from COVID-19 since the beginning of this crisis. My sympathies go out to this patient and all of their family and friends. Here's the latest data we have on race. The Davidson County confirmed cases include 34% white, 14% multiracial or other, 13% Black or African American, 6% Asian, 8% unknown, and 25% are still pending. And of the 56 Nashvillians who have died, 28 were white, 23 were Black or African American, 4 were listed as others, and 1 was of Asian descent. As I've mentioned before, COVID-19 highlights the disparities in health in our society, where minorities and those with limited access to care suffer more seriously impacted by the virus. That's one reason we expanded testing to all Nashvillians. In fact, this past week, over 8,000 Nashvillians did receive a test, and over 54,000 tests have been administered to Nashvillians since the beginning of this pandemic. Our 3 community assessment centers are open today and will be opened Mondays through Fridays, usually from 9 to 3 p.m. And our partners at Meharry Medical College are also initiating a mobile testing. This mobile testing unit will go to different areas of the city to further expand testing. This past holiday weekend, many of us got out and enjoyed the nice weather. Most people did follow social distancing and wore face coverings. However, some people did not do that. I want to be very clear. COVID-19 is still out there, and we are far from finished with this. So we have to take this seriously, or we will see new spikes in cases if we are not careful. That's why we are following a phased reopening plan, so that we can open up slowly and avoid these spikes. But that requires all of us to do our part. We must stick to the roadmap for reopening, and that calls for personal responsibility. We can implore you to do the right thing to slow down the spread of COVID-19, but this really does come down to you. Stay at home whenever you can. Social distance if you go out, staying 6 feet from people. Wear a face covering or mask. It really is quite that simple, but it requires everyone stepping up and following this guidance. And if you are concerned that you may have the virus, get tested and tell your loved ones to do the same. We are in a good place, Nashville, and I'm grateful to all of you for getting us to that point. But we cannot afford to go off course at this moment. As we begin phase 2, please stay the course. Remember, be safe and smart. I now would like to introduce Dr. James Hildreth, President of Meharry Medical College. Thank you.
Good morning, Nashville. As we have pointed out previously, there's a lot about the COVID-19 virus that we do not know. This is especially true regarding the range of disease syndromes that this virus causes. We now see that children who were once thought to be impervious to severe disease from the virus are actually subject to a fairly serious disease that has been called multi-system inflammatory syndrome. This syndrome occurs in children who've tested positive for COVID-19, cleared the virus, and tested negative. They suffer from high fevers, inflammation. One or more organs may fail, as we see in shock, toxic shock, and some of them have neurological symptoms as well. This syndrome appears to be relatively rare, but we're now seeing it all over the country and indeed all over the world. Multi-system inflammatory disorder in children reminds us of something that we observed in the SARS outbreak in 2003. That is that many individuals having suffered severe lung disease could not go back to work for more than 2 years because of the lasting effect of the SARS virus. And given that 1.6 million Americans have been infected and some suffered severe disease, we'll need to be on the lookout for long-term consequences of COVID-19 in our people as well. One thing we do know for certainty about the virus is how easily it can spread from one person to another. We've seen that here in the United States. It's indeed been seen all over the world. These small clusters can quickly turn into major outbreaks. Last time I reminded you of the situation in Albany, Georgia, in which 2 funerals resulted in, at one point, them having the highest per capita rate of infection, one of the highest in the country. And witnessed the outbreaks on cruise ships, in prisons, meatpacking plants, churches, and other venues where people gather together in close quarters without the ability to socially distance themselves. In all of these cases, undoubtedly, an unwitting human vector carried the virus into those groups, to those places, and gave the virus to others. Those small clusters had the potential to become major outbreaks. So, having witnessed what we've seen over the last few days on Memorial Day holiday, where there are large groups of people not wearing masks, not social distancing, we can be fairly certain that there are going to be some minor outbreaks over the next 2 weeks. And those minor outbreaks can turn into clusters, clusters can turn into surges, and we'll find ourselves right back where we started. So Nashville, in order not to undo the work that we've done over the last several weeks, weeks of social distancing, weeks of staying at home, weeks of washing our hands frequently, doing all those things that kept us safe. In order not to undo all that work, it's important that we keep doing those things a little while longer. Nashville as a city has fared very well compared to some other cities of our size with respect to COVID-19. We did that together as a collective community. And that concept of a collective community is really important because we are the vector giving the virus to each other. We cannot forget that. We are all in this together, as Dr. Jahangir just said, and by protecting ourselves, we protect each other. On September the 11th in 2001, on that morning, a cataclysmic event happened in our country. And on that day, 2,996 people died from an act of terrorism. And then, from my perspective, the country was galvanized in a way that is seldom seen. Galvanized by fear, galvanized by anger, galvanized by anxiety. All of us came together. Now, COVID-19 is like September 11th happening every 2 or 3 days. Every 2 to 3 days, that many people are dying from this virus. And what's curious to me is, why haven't we galvanized around this like we did on September 11th, 2001? It's time for a September 11 type response to the virus. And I would think that 100,000 people having died would be sufficient, especially given the potential for 100,000 more people to die. So I'm pleading with all of us to have that same level of galvanization coming together to protect each other. We got this, Nashville. Let's protect ourselves, and by doing that, protect our neighbors, protect our community. We got this. So please don't be a vector. And with that, I'd like to introduce Dave Pomeroy, who is the president of the Nashville Musicians Association. Thank you.
Thank you, Doctor. Appreciate your good words. Hi. As president of the Nashville Musicians Association, AFM 257, I appreciate the opportunity to speak today on behalf of the working musicians of Nashville. It is no secret how important the musicians of Nashville are to our identity as a city and also to our economy. Unfortunately, our industry has been hit particularly hard by the COVID-19 pandemic, and thousands of musicians have lost most, if not all, of their income for the foreseeable future. Our road back is not an easy one, but we are slowly making progress one step at a time. First, we campaigned to help convince the governor to follow the federal guidelines for unemployment. Since then, the Nashville Musicians Association has been in steady communication with the Tennessee Department of Labor to offer help to musicians who are self-employed independent contractors in filing unemployment claims. We've also been teaming up with various organizations that offer financial assistance for those in the music industry. Musicians need to get back to work, but we cannot ignore safety concerns either. We need cooperation from everyone involved to be able to do so safely, which includes the cooperation of our audiences. We have worked with various national, state, and local entities to create our Musician Safety Guidelines document, which provides suggested safety measures for returning to the workplace, both for live venues and recording studios. This document is available on our website and elsewhere and is being updated regularly. This is a time to work together for the greater good of our entire community. If we treat each other with the same mutual respect that made Nashville into Music City, public health and safety should not have to become a political debate. We stand ready to help in any and all efforts to move forward together. After the 2010 flood, Local 257 created a 501c3 flood relief fund, and we raised and distributed more than $150,000 in tax-deductible donations that provided direct financial assistance to local musicians. We are very pleased to announce that the fund has been reactivated and renamed the Nashville Musicians Association Crisis Assistance Fund. We are now accepting tax-deductible donations that will be distributed equitably to Nashville musicians, both union members and non-members, who need help making ends meet as they recover from the devastating financial consequences of this pandemic. I encourage everyone who is able to do so to donate to this fund. If you have enjoyed live music in Nashville, have a favorite song that lifts you up, or simply appreciate how much Nashville musicians have given to our city, you can make a difference in their lives by making a contribution to the Nashville Musicians Association Crisis Assistance Fund through our nashvillemusicians.org website, or donate at any SunTrust bank, as well as by mail to 11 Music Circle North, Nashville, Tennessee 37203. Nashville has a music community like nowhere else on earth, and we can show the world how to work together for the greater good of all of us. We are honored to be part of this recovery effort as we rebuild musicians' ability to make a living in this industry that brings so much to this place we call Music City. Thank you.
Thank you, Mr. Pomeroy. Let's begin today's Q&A session with Jeremy Finley at WSMV. Jeremy?
Yes, good morning, everybody. Had two questions. One being, want to get an idea of this is the week when your investigators will begin going out to businesses and issuing citations for employees not wearing masks, or if you're still in the education phase. Also wanted to know if you have written any citations, how many have been issued. And then my second question, I think, is for Dr. Hildreth. We're finding out from Customs Enforcement in Tennessee that there are daily discoveries of fake testing kits coming through the state. And my question is, what is the danger of these fake testing kits if they do end up being purchased by cities or municipalities or even people? So those are my two questions. Thank you.
Thank you, Jeremy. We'll start with Dr. Caldwell and your enforcement question.
Good morning. We are still in an educational phase. We just started phase 2 yesterday. Over the weekend, we received more than 95 complaints. Most of those have been about employees not wearing facial coverings or not wearing them properly. I'm also aware of gatherings over the holiday weekend where large crowds of people were not following social distancing and were not wearing facial coverings. I'm also aware of issues with bars opening their dance floors. This is a violation. The number of new cases reported this morning is a serious reminder that these types of gatherings puts everyone at risk. These gatherings have been linked to the greatest risk of community transmission of this disease. I have personally visited, and yesterday was up and down Broadway, talking to people, handing out masks, as well as talking to the managers of all the establishments there. And I have found overall there to be a great compliance with the managers and in talking to the employees. I want to see the signage that's required to be at every entrance, and I want to see all employees wearing masks. I did observe that as I was there yesterday. If you are a Nashville business and you have questions about phase 2 reopening, there are many resources available to you. Please go to the covid19.nashville.gov website and you'll find guidance, the Public Health Order number 6, which details very much what is required and what is just suggested. They're frequently asked questions, and they're all also informative webinars which cover the requirements. I'd invite you to send us a message as well. We have an expert technical advisory support team on reopening, and we will be there to assist you if you have any questions. To our community members, you have an opportunity to reward establishments that are following the requirements, such as appropriate social distancing and making sure employees are wearing face coverings. If you see a restaurant or retail establishment that is not following the rules, choose another place to go. Just let us know. Go to the covid19.nashville.gov website, go to 311, go to Hub Nashville online or on your smartphone. You can report that business and we will follow up. Our teams of Metro Public Health Department and Metro Nashville Police will be responding. Let me just emphasize to you businesses that choose not to follow the rules, you are putting the public's health at risk. And I want you to know that while we are in an educational phase now, we expect cooperation and compliance. I am observing that is happening mostly throughout different parts of our community. And we will intensify our enforcement where we receive more than one complaint after we have reached out and made clear that we are satisfied that they understand what the guidelines are. And you will be hearing more about that in the weeks to come. My hope is that we will see a few entities who may not be complying now very rapidly come into compliance. Thank you.
The question regarding the unreliable kits is a really important one. And the main danger of those kits is that we'll make decisions about the health status of someone based on faulty information. Someone who is positive might test negative, and of course that would be counterproductive to preventing the spread of the virus. And it may also be that someone who's negative would test positive, which would have consequences as well. So it's really critically important that the tests we use are reliable, that they're vetted. And I'm really happy that the FDA has really clamped down significantly on a number of kits that were unreliable and untested. So I think this is a critical issue, and we must make sure that the kits we use are in fact vetted appropriately and they're giving us reliable information, because our decisions we make based on those kits are critical decisions.
Kara Hartnett of the Nashville Post. Kara.
Hi, questions. I was just wondering, what are our contact tracing capabilities as it relates to tourism sites like Broadway? Like, how do you compile and look at that data? And with most of them, or a lot of them, I guess, being out of state, how do you coordinate with other states' contact tracing initiatives?
Thanks for your question, Kara. Dr. Caldwell.
Oh, thank you for asking that question. That's an excellent point. The data that we share with you every day is based upon Nashville-Davidson residents' data. So anytime somebody goes for a test and there's a positive lab, that laboratory is required to make sure they give that information to the Department of Health, the local Department of Health, of where that person resides. So if we see clusters, we will work with our partners across Tennessee as well as across the country in communicating that information. So there is a system in place, and it's focused primarily on where you reside. So if there are a lot of people who have gathered in one particular place and then they go in different places, we work with the CDC to help us with those clusters.
Chris Davis, News Channel 5.
Dr. Hildreth mentioned the multi-system inflammatory syndrome in children. Are there any reported cases in the Nashville area, and are you tracking and keeping a close eye on those cases?
The question was about the inflammatory syndrome in children.
The Department of Public Health would be very interested if there are any cases. We have not been informed of any cases, but it would be required for any physician who is taking care of a patient to report that to us. Thank you.
Julia Palazzo at WKRN. Julia.
Good morning. Thank you. Dr. Jahangir, I was wondering if you could talk more about the heat maps that were sent out. And I know a couple weeks ago, Leslie Waller, I know she's not there, but she was discussing some clusters in the Northeast corridor. Just wanted to get an update on that, or maybe Dr. Caldwell can answer that question. And Dr. Caldwell, were you, when you were just speaking about violations, are you able to tell if reopening is directly impacting the data? I don't want to directly misquote you here, but I think you were saying something along the lines of that, saying it's been linked to some of the data. I don't want to misquote you, but I hope you understand what I was asking. Thank you.
Hey, Julia. Dr. Caldwell.
When I was speaking before, I was speaking in general what we've seen, not only in Nashville, but across the country, that it is gatherings that have caused the greatest harm where people are not socially distancing. So I was not stating anything new about what we've seen in the past couple of weeks. I was inferring what we had seen previously, and it is a great concern of mine. As for the heat maps and the contact tracing, you're right. We continue to see spread in the Southeast area as well as Madison. We believe this is directly related to the communities that are living there. They're spreading it within their homes and spreading it within their communities. I'm really pleased to let you know of our continued and augmented partnership with Siloam Community Health Center, as well as the Tennessee Immigrant Refugee Rights Coalition. The multicultural teams and community health workers have been hired, they've been trained, they're being deployed, and we're looking to expand that. We have a lot more work to do, and we are looking at other opportunities to have pop-up mask distributions and testing moving forward, and there'll be more details to come on that.
Harriet Wallace at Fox 17.
Yes, good morning, everyone. I've got a few questions this morning. First, this one is for the mayor. We know that there are, obviously businesses reopening. What is the message or protection for those employees who are afraid of returning to work because of the virus, but risk losing their unemployment? My second question, this one is from my amazing colleague, Dennis Ferrier. He says that Metro is one of the last entities with a defined pension and is costing taxpayers millions. Even the state has gone to defined contribution. Why is Metro refusing to go with the private sector, with that being especially relevant in these days? And my third question from my duly amazing colleague, Kathleen 3, is asking, because of the limited summer activities available for kids, what is the plan to focus and keep down youth crime with them not having many activities to participate in? Thank you.
Thank you, Harriet. Mayor Cooper.
Thank you, Harriet, for those 3 questions. The first on employees being afraid of reopening. Dr. Caldwell, I think, addresses that is we need for people to feel safe and not just safe at home. We do feel that with proper public health protocols being enforced and followed, that people can return safely to work. And if staff do not feel safe, they need to report it to the public health department, and they will arrive and they will walk through the practices and what should be done in order to be safe. In order to get back to work, everybody needs to feel safe, be safe, and we need, as a city, to have a reputation for being safe in order to attract business back to our city. The second question about Metro's pension plan is, interestingly, our pension plan is the one thing about Metro that, in fact, probably is pretty well funded historically. And so I think we can take some comfort in that. Now, in terms of our arrangements with our employees and the future of Metro, obviously this is a subject that needs to be repeatedly discussed, but in terms of the Metro's pension fund right now, it has been funded at a reasonably good level. This is not OPEB or other basically health benefits for retirees. Now that is not funded, and that's a separate subject. I know of no other city or any city that has done a good job with that. And obviously, I would love for Nashville to be a leader in what is a long-term, really multi-generational financial problem that we see in other things too, such as Social Security funding and Medicare funding. We have our own contribution to that, but not in terms of pensions. Then in terms of activities for kids, we're going to be excited to try to roll out more activities this summer. I'm very proud of Nashville that really we've not seen a big change in crime rate given the dramatic change in how we were living together through the Safer at Home orders, though coming out in the next year and the next months, we need to get back to normal. And getting back to normal is childcare, is kids, it's summer programs. Today, let's just take a moment. Getting to phase 2 is an achievement for this city. Getting to phase 3 is going to be an achievement for this city. We can do it, but we're going to do it by keeping each other safe. We're going to do it, frankly, going back to your first question, by people in a place of business not feeling safe and frankly reporting it and saying, I don't feel safe. Have the courage to do that. Have the courage to help us, help you be safe. We are going to go out and remind people what they need to do. But with appropriate protocols, we can get back to work. We're going to have the virus in our community for a long term. Our problem is our technique in living with it. Thank you.
And Harriet, if Dennis didn't get the 2 emails I sent to him on that question, I'm happy to resend them. Nayeli Alamia at 96.7 FM.
Hi, good morning. My question is, I know that you guys are distributing face masks within the Nashville area, but I do know that the certain areas where there's more cases based on the heat map is in the area code or zip code 37211 and 37013. Why is there not any distribution of face masks in this area, in this specific area?
Thank you. Dr. Caldwell.
We are continuing to create a plan that distributes face masks throughout the community. The success of having them at our community centers in Bellevue, in Madison, in Smith Springs, and Hartman Park has been tremendous success. We invite people to go to those locations to get the masks. And we did a trial of pop-up mask distribution on Broadway yesterday. It seemed to be a great success, and we're going to be doing more of those throughout the community. And please give us your ideas. If you know a specific place and time where you think we could do a pop-up mask distribution, that would be very much well received. And we also can plan to do more well-advertised mask giveaways on a case-by-case basis.
Damon Mitchell at WPLN. Damon?
Hi, Chris. Just one question about the heat maps. Is there an explanation for the number of active cases in the 37217 zip code? And I'm specifically talking about the red pocket that is just northwest of the airport. Looking at a map, there doesn't seem to be too much activity in that area.
The question is about the heat map and specifically 3721. Did you say 37217? Okay. Dr. Caldwell?
There is no particular new cluster that we're seeing other than what we believe are spread at home and in the community. There may be certain situations where there's a particular work site of a couple dozen people or a community gathering that we had learned about for a couple dozen people, but nothing dramatic except from what you see, that it is within the community. So anytime that people do interact, they should know that the risk of COVID is throughout the community, but especially in that area. Please continue to wear facial covering, use social distancing. It is so important. Remember, your face covering protects the person that you are talking to. It shows respect for people, and we'd like to see more of it.
Nancy Amons at WSMV.
Hi, good morning. Thank you. I have three questions. I know that you can enforce the guidelines by businesses, but what about things like neighborhood parties and voting parties? Is that frustrating? Can you do anything when there are large groups of people who aren't appearing to follow the safe guidelines? I have a question about contact tracing. When you have so many people, for example, in a bar on Broadway, and people don't have to sign in, how do you do contact tracing if you've had an outbreak of someone who is at a bar? And the third question is about the 4th of July. I know it's going to be televised and not have a public event. How are you planning to prevent people from just flooding into the downtown area to watch the fireworks as they've always done? Thank you.
So the first question is about neighborhood parties. The second question is about contact tracing, and then the 4th of July. Dr. Caldwell.
These are all important issues that I am contemplating. The parties, please let us know. The Department of Health does not go out as the police are out already in the community. So communicate through Hub Nashville with a complaint or call the local department police. They are our partners, and they are the ones in these particular situations to drive over if there is a disturbance of any kind. And a large gathering of a party is something that I have worked with Chief Anderson and his team at Metro Police, whether it be in parks as well. We work with Monique Odom and Parks Police. Let us know, and I will work with the police to respond and at least let people know. We really appreciate that they socially distance. Now, what about contact tracing at a bar? You're right, that's a challenge. And we very much want people to go out in small groups of 4 or 6 so that we are able to, when we need to do the contact tracing, make it so that it is easier for us to do. I know there are a number of restaurants, for example, that are tracking and taking reservations so they would know who is been in their restaurant. There are other places that just don't do that. So it is not easy to do. If we feel it is urgent, and we've done this before, that if there is a larger outbreak, we would let people know, oh, if you've been to this particular place at a certain time, please go get a test. But we haven't done that at this point because we know that virus is throughout the community, and we just have to assume that everybody has it. The third question, Dr. Jahangir will answer.
Regarding the 4th of July, this CVC has put that on, and it's a very small, I think as they said, 10, 15-minute show to honor first responders and healthcare workers and others. So I think the general messaging there is it's going to be a really small show. There's not going to be all these events downtown like there have been previously. We're asking people, there's no reason to come down. It's not worth your time to drive up to downtown. Enjoy the show on TV. There's going to be a great music, from what I understand, that goes with it, that's going to be available on your television set. And so asking people to respect that is how we're going to enforce that. So again, I appreciate as a healthcare worker and as somebody who's working with a lot of first responders, we appreciate what the CVC is doing, but it's not going to be the traditional 4th of July we've seen in Nashville. Hopefully years to come, we'll be back to that. But this year, stay at home, enjoy the show on TV. Thank you.
Our final question is from Yihan Jung at the Tennessean.
Good morning. Of the 150 new cases reported today, how many delayed results from this weekend? And can you explain what's causing...
Sorry, you broke up there. Of the 150, what was that?
Can you hear me?
Yes.
Of the new cases reported today, how many are the delayed results from this weekend? And can you explain what's causing the lag reporting from the labs? Is this the same lab that had issues last week? And is there concern about, perhaps not having timely or complete data when making health and policy decisions?
Okay, thanks. Dr. Jahangir?
I thank you for the question. I think it's just a few, 10, 15 delayed. We have spoken with live. It was a pure computer thing, like it was last time. I follow the turnaround times of the labs pretty regularly. This lab has not dropped behind the ball on that. We had a conversation with them after the last incident. They've increased their staffing and they're putting out new reports. Now, listen, I'm not happy that it's happened now twice, so I don't want to give any sense of that. And as I've always said, this is a business that we'll continue to watch. I don't believe it has delayed anything in regards to policy decisions and so forth, because if you look at how we report our rolling average, it's 14-day rolling average. We're also looking at the day the test was done rather than collected. So if you go on our website and look at our graphs are all flat for the rolling 14 days. So it hasn't made any difference in policy decisions. And a rolling average literally has been, I think it's 86, and I think it was 87 14 days ago. So it hasn't changed anything there. So, and all the metrics are green. So remember, as I've said before, and I didn't say anything today, we look at a multiple set of metrics, and all our metrics are in the standard in which we feel very comfortable moving forward. So we'll keep track of how these labs continue to report, and if there becomes a consistent problem, then it's very easy to not use certain labs. Thank you.
Those are all the questions we have this morning. I'd like to thank Dr. James Hildreth and Mr. Dave Pomeroy for participating in today's press briefing. The next scheduled Metro COVID-19 press briefing will air on Thursday morning, May 28th at 9:30 a.m. As a reminder, you can stay up to date on Metro's coronavirus response at covid19.nashville.gov. Thank you for joining us. This concludes today's COVID-19 press briefing.
This has been a service of the Metro Nashville Network. If you would like to see this presentation again, or for more information about this and other programs, visit nashville.nl.